You are most welcome to academia. This is mental health presenter Mr. Malambo. We are actually going to look at psychiatric nursing. Under psychiatric nursing, we will consider the following questions. Number 1, which is A1, define psychiatric nursing. A2, list 10 qualities of a mental health and psychiatric nurse. B, state 5 principles of psychiatric nursing. C, discuss any 5 predisposing factors to mental illness or psychiatric conditions. Then D, explain 5 types of admission in psychiatric nursing. Then E, describe any 5 basic counseling skills. These are the questions or other problems we will consider under psychiatric nursing. We will start with the first one and define what we are asked. A1 says, define psychiatric nursing. What is psychiatric nursing in other words? Do you know it? How do you understand it? So that is the question that requires us to answer it according to what it has been asked. Define psychiatric nursing. Answer. Psychiatric nursing is a branch of nursing concerned with identification, prevention, and care of people suffering from mental illness. That is the definition for psychiatric nursing. What does this definition mean? It means that under nursing, there is the branch called psychiatric nursing. Under mental health, basically, there is a branch called psychiatric nursing. And this particular branch is concerned with one, to identify, to prevent, and to care of who? People who have mental illness. So psychiatric nursing is the branch of nursing concerned with identification, prevention, and care of people suffering from mental illness. We call that as psychiatric nursing. In an exam, a question may come. Define psychiatric nursing. Still the answer is the same. Is the branch of nursing concerned with identification, prevention, and care of people suffering from mental illness. We go to A2. A2 says list 10 qualities of a mental health and psychiatric nurse. List 10 qualities of a mental health and psychiatric nurse. Answers are as follows. Number 1, qualities. Self-awareness. Number 2, self-acceptance. Number 3, accepting the patient. Number 4, being sincerely interested in patient care. Number 5, empathizing with the patient. 6, reliable. 7, accountability. Number 8, ability to think critically. Number 9, professionalism. Then number 10, being available. Number 11, patience. Number 12, open-mindedness. 13, the ability to not take things personally. Number 14, strong verbal skills. 15, good observational skills. Lastly, 16, the ability to lead and to participate in a team. So basically, you can choose 10 from the 16 that I've given you as qualities of a mental health and psychiatric nurse. So you as the psychiatric nurse, you need to possess good qualities. Be a reliable one. Be sincere and interested in patient's care. Accept the patient. Be self-acceptance and self-awareness. Have the ability to think critically. Act profession to say, you act profession. Be available for everyone and have the heart of patience. Mutima. Okay, be open-minded. Have the ability not to take things personally. Okay, have strong verbal skills. Kulanda. Have good observational skills. And have good ability to lead and to participate in a team. These are called qualities of a mental health and psychiatric nurse. We go to B. B says state 5 principles of psychiatric nursing. State 5 principles of psychiatric nursing. You state how many? 5 principles of psychiatric nursing. Number 1 principle: compliment, reassure, and model appropriate behavior. That is number 1 principle. Compliment, reassure, and model appropriate behavior. That is 1 principle. Number 2, make reality interesting enough that the client prefers it to his or her fantasy. Make reality interesting enough that the client prefers it to his or her fantasy. That is number 2 principle. Number 3, be honest so that the client can rely on you. That is the 3rd principle of psychiatric nursing. So be honest so the client can rely on you. The 4th one is suggesting, requesting, or asking works better than commanding. Suggesting, requesting, or asking works better than commanding. That is the 4th one. The 5th one, have patience. Move at the client's pace and ability. Have patience. Move at the client's pace and ability. The 6th one, we can even add more, then you can actually choose from there. The 6th one is remember to assess the physical needs of your client. Remember to assess the physical needs of your client. The 7th one, make frequent contact with clients. It lets them know they are worth your time and effort. Make frequent contact with clients. It lets them know they are worth your time and effort. Another principle is avoid a highly competitive activity, that is having one winner and a room full of losers. The question. Another principle we can also put is do not allow a situation to develop or continue in which a client becomes the focus of attention in a negative manner. No. Another principle: if the client's behavior is bizarre, base your decision to intervene on whether the client is endangering self or others. Another principle we can add is nursing interventions should center on the client as a person, not on control of symptoms. Symptoms are important, but not as important as the person having them. The last principle we can add on is allow a client an opportunity to set on pace in working with problems. These are what we call principles of psychiatric nursing. You can choose either of them, but according to the question, it requires you to write how many? 5. State 5 principles of psychiatric nursing. You can state them like man. We got to C. C says, discuss any 5 predisposing factors to mental illness or psychiatric conditions. Discuss any 5 predisposing factors to mental illness or psychiatric conditions. Now, we need to categorize these predisposing factors to mental disorders. So, the categories of predisposing factors to mental disorders are as follows. Number 1, genetic factors. Number 2, biochemical influences. Number 3, neurobiology. Then number 4, viral theories. Number 5, stress. Then psychoanalytic theories and social culture theories. These are what we call predisposing factors. Now, we need to explain them categorically. Under genetic factors as being the predisposing factor to mental health, what do we mean by genetic factors? So, studies have shown that relatives of individuals with schizophrenia have a higher probability of developing the condition than does the general population. So, over about 10% of first-degree relatives develop what? Schizophrenia as a mental disorder. That is what we mean under genetic factor. Meaning, these mental disorders, according to the study, they are passed on from generation to generation, meaning from one individual to another in the linkage of the family. The other predisposing factor we said is called biochemical influences, where we find dopamine theory. Dopamine theory explains that excessive dopamine is found in patients with schizophrenia. So drugs that decreases dopamine are known to make schizophrenia better. Okay? Then what do we mean by neurobiology? So the prefrontal cortex and limbic cortex may never develop fully in the brains of persons with schizophrenia. That is according to the research. So structural brain changes, okay, where we find, the enlarged ventricles, mild cortical atrophy, reduction in brain volume, may also be a structural brain change in its structure that may actually cause these mental disorders. Decreased cerebral blood flow to the frontal lobes may also cause mental disorder as the predisposing factor, falling under neurobiology. What do we mean by viral theories? Prenatal exposure to influenza virus, particularly during second trimester. Born in winter or early spring, under viral theories. Stress. Now, when someone is stressed, how is it that it can actually cause mental disorder as being the predisposing factor to mental illness or psychiatric condition? Remember. Now, when someone is stressed, there is triggering effect in a genetically predisposed individual, which is actually stress vulnerability hypothesis. And increased expressed emotions may also cause these problems, okay, like relapse. Under psychoanalytic theories, regression to the pre-oral stage with the use of the defense mechanisms of denial, projection, and reaction formation. Loss of ego boundaries with a loss of touch with reality may also be one of the predisposing factors that actually falls under psychoanalytic theories. What about social culture theories? Although prevalence is uniform across cultures, found to be more common in lower socio-economic statuses. That is according to studies. So downward social drift. So here you will discover to say the social culture theories as being the prevalence, which actually is uniform across cultures, has been found to be more common in lower socio-economic statuses as a downward social drift. Okay, so those are predisposing factors to mental illness or psychiatric conditions. Like we said, how many are they? 1, genetic factors. 2, biochemical influences, neurobiology, viral theories, stress and psychoanalytic theories, and finally social culture theories. We go to D. Under D, we are told to explain 5 types of admission in psychiatric nursing. Okay, 5 types of admission in psychiatric nursing. Number 1, we have what is called admission by court adjudication. Under this one, the client is admitted into a psychiatric forensic unit by the court's decision, whilst their case is being reviewed by the courts of law. So the court, or rather court's request for assessments, treatment, and psychiatrists are required to submit the periodic reports to the courts. So in these reports, the following examinations should be included: previous psychiatric history, past medical, surgical, early childhood, and adolescent developmental history, alcohol and drug history, family history of any mental history or any offenses in the family, then marital status, educational and employment record, then prognosis of disorder and outcome if treated. These are the things that are considered and the examinations done in the report. So, according to the question, explain 5 types of admission in psychiatric nursing. The first one is admission by court adjudication. This one we've explained. Number 2, it is admission under medical board. Admission under medical board. What do we mean? This is when the employers write a letter to the hospital requesting the medical officers, who in turn consult the psychiatrist where applicable, to examine the patient thoroughly and come up with a report to say whether that person can continue working or be retired on medical grounds. Number 3 type of admission is called involuntary admission or compulsion admission. What do we mean by this type of admission? So this is where the patient is not willing to be admitted and does not accept treatment, or rather is unable to give consent for treatment, but he or she has a mental problem or is actually a potential absconder. Okay? According to human rights, a patient is not supposed to be forced to be admitted or to be forced to take medication. Hence, a detention order is obtained by a family member or a form that is signed by the magistrate, which will actually allow medical personnel to receive the patient for admission and administer medication. The 4th admission under types, it is called emergency admission. What do we mean by emergency admission? A family member, or rather a friend, a community or health worker, or any responsible citizen may request orally or in writing that health institution admits a suspected mentally disordered person as an emergency admission under the following conditions. 1. If a person is in a community, becomes to act in a manner inconsistent with the norms of society because of suspected mental illness. 2. If a person in the community is believed to be mentally ill and because of mental illness lacks proper care in terms of food, clothing, and shelter, or is neglected or cruelly treated. If any person believed to be suffering from mental illness is dangerous to himself or others and property, then there will be the request of an emergency admission. The 5th one type of admission is called voluntary admission. This is where the patient is willing to be admitted and knows that they have a problem, and a medical officer in charge of the mental hospital sees that the patient really needs admission. So according to the Mental Health Service Bill 2006, it states that patients aged 18 years and above must be encouraged to opt for voluntary admission into a psychiatric institution, facility, or ward. So the patient with a mental health problem may seek help from any health facility, including primary health care clinics, as first contact before being transferred to a psychiatric hospital rather unit. So if any patient is admitted to a psychiatric facility as a voluntary patient, the person in charge of the hospital ward must notify the patient's parents, guardians, or relatives as soon as possible. So in the absence of relatives, community leaders from the same locality must be notified. Where a patient is already admitted to the mental health facility as a voluntary patient but wishes to discharge himself contrary to the considered option on the person in charge. then the patient may be held at the institution or ward as an involuntary admission upon recommendation of the attending mental health practitioner. A mental health practitioner should, physically and mentally examine any voluntary patient within 24 hours of admission to a mental health facility. This is how you need to explain or rather extrapolate under types of admission in psychiatric nursing. Finally, the last question says, describe any 5 basic counseling skills. Okay, describe any 5 basic counseling skills. So, basic counseling skills. There are actually 8 basic, but according to the question, it requires us to describe just any 5 of them. But what we need to know is that there are 8. So there are 8 basic skills of counseling that a nurse needs to learn. It's very important. So these skills are used by the nurse when counseling and are necessary for forming a working relationship with the patient. So the skills are: 1, attending. Number 1, attending. Number 2, listening. Number 3, clarifying. Number 4, reflecting. Number 5, paraphrasing. Number 6, asking questions or prompting. Number 7, summarizing. And 8, challenging. These are skills. Now we need to explain, because the question says describe any 5 basic counseling skills. So I am going to explain them in totality. We are going to start with the first one, attending skills. What do we mean by this? So patients in distress are, acutely aware of the attention and inattention of the attending nurse. And basically they become so sensitive to both verbal and non-verbal cues. So a nurse or a counselor must show through their body position and facial expression that they are paying attention. For example, by directly facing the client and making good eye contact. So attending as a skill, it involves what is called SOLER. SOLER. Attending skill involves what is called SOLER. SOLER. Under this acronym, S stands for sit squarely. Okay, sit squarely. O stands for open posture. Then L stands for lean forward. Lean forward. Then E means eye contact. Then R stands for relax as you listen. This is called attending skill. So, it is important that these are put into practical. The second skill, it is called listening skill. Under this one, listening includes hearing what the patient has to say, gathering and processing information, and observation of non-verbal cues. It requires more than a physical relationship, but it should have it should involve personal contact during consultation. Acting listening demonstrates empathy and letting clients know that they are being fully listened to and understood. Very important. Number three skill is clarifying skills. Clarifying is an attempt to understand the client's statements. Okay? So asking clients to give examples to clarify what they mean can help you understand better. Other strategies used to clarify something the client has said include summarizing at the beginning, during, and at the end of any session. Number 4, reflecting skills. Under reflecting skills, what we mean, so reflecting involves the nurse acting as a sounding board for the patient by reflecting back what she or he is saying or feeling. So the nurse does this by repeating the client's verbal and non-verbal message. So reflection conveys back to the speaker their thoughts and feelings. Paraphrasing skills. The nurse determines the basic message in a client's statement and then rephrases it or restates it, the sentence in similar words used by the patient. So it gives an opportunity to test your understanding of what it is being communicated or what is being communicated. Asking questions or probing skills. Under this one, probing is a counselor's use of a question or statement to direct the client's attention inward to explore his or her situation in more depth. So a probing question, sometimes called an open-ended question, requires more than one word, yes or no, answer from the client. So when they paraphrased, or rather when they phrased as statement, the probe contains a strong element of direction or directed by the counselor to say, now, example, tell me more about your relationship with your parents. Or suppose we explore a little bit more your ideas about what an alcoholic is. Such questions. Right? Then summarizing skills. To summarize is to select the key points or basic meaning from the client's verbal content. So the feelings and tie them. Okay, and tie them together. This should not include the assumption of the counselor. So summarizing then is a review of the main points already discussed in the session to ensure continuity in a focused direction. So challenging skills. This one, the counselor invites the client to examine thoughts and observable behavior that is self-defeating and change, such as thoughts, behavior for the better. Now, an example is if he or she might ask this question to challenge a belief, what is your evidence for this belief? Or challenge clients to explore behavioral consequences. So friends, in a summary, basic counseling skills helps to form a good relationship between you and the patient. So it is important that we act so politely. We know first ourselves, even as we speak and talk to our clients, they listen to us vividly. Otherwise, this is what I prepared for you, and may God bless you. This was Mr. Malambo Academia Admin. It was under Psychiatric Nursing, which is mental health as a course. God bless you abundantly. Thank you. Amen.